Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
So we got the immediate upper denture back. It's all processed. The only thing that we reused from the last visit were the teeth. All new acrylic. Don't even have the master cast anymore. Once this gets processed on the cast actually has to get broken out of here to be able to get this out. So now we're going to go pull some teeth, fit this in, make a couple little adjustments, and then I'll see the person the next day for further follow-up.
All right, so I have the patient in the chair. He's all numbed up. I'm just double checking, making sure everything's numb using my spoon excavator around those, just what's left of the roots of the two upper premolars on his upper left side there, poking around, checking. He's got those two premolars. He's got this broken central incisor. He's got the other central incisor that has a crown on it. That's why it looks so good. He's got that lateral incisor root. And then finally, he's got a canine. The canine's mostly solid, but there is a large area decay, so I'm worried that's a little gonna break on me most likely. So he mentioned he was still feeling a little something, so I'm just gonna give him a little bit more anesthetic. I'm using Articaine, probably my go-to favorite anesthetic since I started using it about 10-15 years ago whenever it came out. Fancy French stuff made in France. Okay, and now here's just a shot of the instruments I'm going to use. Spade proximator, a straight elevator, a 301 straight elevator, then at a pair of ash forceps. So my go-to instrument's always the spade proximator. It's got that nice sharp tip so I can work it up into the PDL space or down, depending on which way you're pushing it. But there you can see that I can get the whole tip down in there, and I'm just working it, rocking it, slight twist. It doesn't have a really fat handle, so you can't put a lot of torque on it, because put too much torque on it and you can actually break it. But that's usually, I find it works well for these broken off roots, and a lot of times I can remove teeth just with this instrument. So that's what I always set out to get a tooth out with the first instrument that I use. Sometimes you have to go up to the next one. So typically I'll start with the spade proximator. If I can get them out with that, great. If not, I'm going to use the next step up, which is going to be my straight luxator. It's got a little bit different shape blade, and it's got a fatter handle on it too, so you can actually rotate it and twist it some more. Again, since the tips are thin on it, you don't want to really crank on it like you could with an elevator, which has got a much thicker tip on it. But again, just taking the spade, going all around. Couldn't get the teeth out, so now let's go to the spade, to the straight luxator. And there you can see that fatter handle, and just a different shaped tip too. I'm getting a lot more movement. You can see the roots really starting to move there. So I just keep working and going all around the tooth and just seeing which direction the tooth wants to come out, and there it is. And then you could see this premolar had some pretty spindly roots, so I'm glad we were able to get those out without breaking them. Not that it's that big a deal to go digging for them, but if we can get the tooth out or the root out in one piece, it's easier for everybody. So let's go the other one. That one's going to come out in two pieces. There's one nice long spindly root, making sure it didn't break off the tip. And now let's go get the other one. And again, just working it around, twisting it. Basically, I'm just putting it into the PDL space and trying to push the root tip towards where the other root used to be, and that's the direction it wants to go. Deliver it with my fingers. All right, so 2 down, 4 more to go. So, and again, you can see those two both had pretty thin roots on them, so I'm glad we got them out in one piece. And now just removing a little bit of that bone that was in between the two. It got busted up. Patient just is getting an immediate denture. He's not planning on getting any implants, so I'm not worrying about doing any type of bone grafting. But I just want to get those loose pieces out, because anything loose like that is not going to heal. Your body's just going to push it out, and it's easier for me to remove it. All right, let's go on to the next 4. Again, first thing I'm going to do is I'm going to take the spade proximator and work it on all the teeth. I'm working on that broken off central incisor there. I got it moving. I got that, the spade. You can get that tip pretty far down into the PDL space. So we got that one moving. Now let's turn our attention to the other one. We can get that one wiggling as well. And now on to the lateral, and then finally we'll use it on the canine too. And once teeth start coming out too, you'll have a little bit more room a little bit more give to the jawbone. Again, you don't want to, I don't like using too much force in the beginning. I like to just kind of finesse it because it's going to be easier just to remove it. I'll spend 30 seconds extra working my elevators in to get the teeth out, and it'll be easier for everybody. Less surgery for me, less surgery for the patient, easier recovery for the patient. All right, moving on to the straight luxator. That's with the gray handle. Let's see which teeth we can get out with this. Again, working around the broken ones first. Worked around the central. Now let's work around the broken lateral. And as you can see, I got the canine move in there too. And then let's just get the ash on there, see what we can remove. And ash forceps are great for front teeth. I'm using them more and more. It's my go-to forceps for a front tooth. So let's grab that up. Broke the crown that's on there. I think that's just a old feldspathic porcelain crown. I don't think it's an Emax or anything. But there we go. We got the whole root of that tooth out. Let's go back to the other central, the broken down root, and just let's put the ash down a little bit deeper in there to try to get a better grip on it. No go. Clean it up a little bit. All right, let's switch gears and go for the lateral. Again, not much you can get. You want to get the tips of the beaks as far under the gum as you can, get as thick a grip on it as you can, and then you just wiggle it back and forth, a little rotation, wiggle, rotate, wiggle, rotate. It's really moving, and there we go. And again, we got it all in one piece. The patient's got some really long, thin roots on all these teeth. Now this is the canine. Now it looks like a solid tooth, but it's got a lot of decay, so don't worry, it's not going to come out in one piece. Yep, and there we go. The crown broke off. You can see had a big filling and decay on the back side of it. So now we're left with those two broken roots, the central and the canine. So I'm going back to the straight luxator, and that was enough to tease it off. Once the other central incisor was out, there's more room for it. The bone's looser. And again, I'm going to do the same thing around the canine. See, the canines are tough though sometimes because they have pretty long roots. They're big, strong teeth. They're the cornerstone of the dental arch. So they're designed to withstand a lot of chewing force. So they're usually anchored in pretty well. And again, this person's situation, he doesn't have gum disease. Gum disease isn't a problem for him. It's decay. So I'm going back to the spade. I'm going to try to work that deeper in all around, get some movement. I know we had some movement on it already, so it's just a matter of being able to remove the whole root in one piece. So there's a little bit broke off because it was decayed. Let me just get that with my tweezers, my cotton forceps. Add that to the pile, and a little surgical suction so I can see what I'm dealing with a little bit better. And now I'm going to go to the 301. I think this is the first time I had to use the 301 on this case. So it's just it's similar to the straight luxator. It's just got a thicker tip so you can actually use a little bit more force. And I'm just pushing it down into the PDL space, rocking it, giving it a twist, trying to get the root moving. Hopefully getting the root to move enough to just get it up and out. And now I'll just go back to the spade a little bit, try to work it on all sides. And you just feel around the tooth, see which direction, see which way, how the tooth wants to come out. You just got to pay attention to what you're doing. I also like putting my fingers on either side of the tooth so I can actually feel in my fingers as the bone's moving as to which way the tooth's going. So again, I'm getting that pretty far up and under there. So let's take another look, see what's going on. There you can see it. So let's grab it with my ash. And if you could see, I'm grabbing the back side of the tooth, but on the mesial side, I'm actually getting the beaks into the socket of the lateral. So I'm getting rid of the bone that's in between. But because of that, I can grip it much lower down up on the root. And there I can get a good grip on it and pull the whole thing. And again, you can see I had a long, thin root on that tooth. So got them all out. Now let's just clean up, make sure there's no loose chunks of bone, no broken pieces, making sure everything's okay. And in this situation, for I don't do any what's called a veloplasty. I don't trim down the jawbone at all. At most, I'll just use my fingers to kind of compress the plates back and just have the person bite on some gauze, get it to clot. Clean them up. Again, my go-to joke is I don't want anyone to think I beat you up real bad when you leave here. So just getting the bleeding to stop. There's a close-up look at all the teeth, all the little bits and pieces. And there's the other part of that crown, the crown on that central that broke off. There you can see it's why it's so pointy. The tooth part's so pointy. It's been prepped. There you go. So now once he starts to clot, we're going to be ready to fit the immediate denture. I'm just checking, make sure there's no sharp spots. I always check that before, just one final check. So bleeding is pretty much stopped, under control, and then we just put it in and seat it all the way. Now, the day I deliver it, I don't like to do very much adjusting at all. The less adjusting, the better. There's going to be a lot of swelling now, so I'll tell them, leave it in overnight, don't take it out, and I will see you in the morning to take it out and do any adjustments. All right, so the next video after this is going to be the next day visit, the one-day follow-ups. Thanks so much for watching. See you in the next video.